Everyone deserves to be well. A doctor and a prescription and a diagnosis of something is only about 20% of what keeps someone well. Where we live, how much food we eat, all of those things are 80% of what keeps us well.
We're really good about delivering healthcare, but where we're challenged at is addressing all of those other things that promote health. And that really falls on everybody's front door.
One of the things that's been coming up more is this dilemma of patients having to sacrifice, whether that's paying for their light bill or paying for their rent, and having to pay the copay or the prescription.
It's difficult for people that come from historically disinvested communities to achieve health. I tell people about calls that I've been on where the family was using their kitchen stove as a source of heat because they didn't have the gas turned on, or there was no food in the refrigerator. This partnership that we have with the Integrated Health Network, a lot of it is about helping to navigate the healthcare system, but also being an advocate for people that come from disadvantaged communities.
No one should make the choice between their health and their livelihood. And so what we're doing right now is, working with our data team, sort of collecting information about how are we doing this currently? How are we meeting the patient's needs, and what are the systemic and structural barriers preventing that?
Partnerships like this are really important because as we work to dream or think of a new and better healthcare system that is more equity focused, there are folks who need care today.
A lot of people have been coming and they have Medicaid. They do not have a PCP.
I've been having that same issue, but I've been trying to focus on patient education.
For me, being a patient advocate and also a referral coordinator here in the ED, success to me looks like people feeling comfortable, people being able to have a plan of action so that they can have continuity of care when they leave here and not utilize this as a doctor's office per se.
That's what I really appreciate about our role as community referral coordinators, because we really take the time to prioritize what patients' needs are, what their personal behavior and healthcare goals are, and providing that one-on-one personalized and collaborative healthcare navigation to help them reach their goals.
It matters to the patient because that's how you give them the best care. If they feel like they're being taken care of, they feel that collaborative effort between their providers, then they're more likely to understand their health better and to make great decisions in the future.
We always need to be thinking about how to make this system more responsive, more equitable, so that everyone has the same opportunities to thrive and be well.